what I just showed you was the functions. And so if we look at where vitamin C is stored, some of the highest concentrations of where it's stored, one of them is in your adrenal gland. And as we just talked about, why the adrenal gland? Because adrenal glands use vitamin C to make cortisol and adrenaline, right? So think of vitamin C as a major stress support. When you're under a lot of chronic stress, whether it's emotional, physical, or biochemical, you will burn through more vitamin C as a natural course to try to cope and adapt to that stress. And so cortisol and adrenaline are two of the main hormones that help you to do that. We know that vitamin C is concentrated in the liver and the brain. Specifically in the liver, one of vitamin C's functions is the regeneration of glutathione, which is the master antioxidant that helps the liver go through detoxification processes. In the brain, of course, there's dopamine and serotonin, neurochemicals that are critical for brain function. And so there are certain areas of the brain that have a lot more concentration of vitamin C storage, and in the muscle as well. We know, for example, research in humans, and especially in athletes, show that vitamin C supplementation reduces soreness and enhances their ability to continue to perform. We know that vitamin C deficiencies can increase damage to the tendons, which is the area, that area of the muscle, the extension of the muscle that lacks a really great blood supply that attaches to the bone. And so tendinopathy, or people that have a kind of a predisposition to developing strain sprains in that way, have a greater risk of vitamin C deficiency, or oftentimes have vitamin C deficit. This is a diagram showing in a little bit more detail quantitatively how vitamin C is stored in which tissues, and quantitatively how much. I want to point out this highlighted section. The human body contains 1.5 grams of vitamin C, in essence about 20 milligrams per kilogram of body weight, and loses 3% of its vitamin C content per day. So that's lost mainly through the kidneys. Plasma and leukocyte levels of vitamin C reflect the amount absorbed from the digestive tract. As I was saying earlier, leukocyte's a white blood cell, and so what I was saying was researchers think that looking at vitamin C in white blood cells is a more accurate representation of vitamin C absorption and storage, making them important to consider when evaluating the bioavailability of vitamin C. So if we look at these tissues, you'll see just from a pure quantitative standpoint, we've got down here, these are white blood cells. So the lymphocyte contains 3,800, the neutrophils, or rather the monocytes, 3,100. The platelets, almost 3,000 at 2,790. And then we come up here and we can see the adrenal glands, as I mentioned before, the stress response organ, and then the neutrophils at 1,350. And then from there, it just kind of goes down. You see brain 800 to 900, and these are micromoles per liter is the dosing here. And then, of course, skeletal muscle 200 to 300, spleen, liver, pancreas combined 600 to 900. So this shows you where vitamin C works, right? So where it's more highly concentrated, as a general rule, is where. It's not to say that in tissues where it's less concentrated, it doesn't have a function, but in those key areas, we see a lot of its functionality play out. Now, that being said, let's talk about the symptoms of vitamin C deficiency. So now you kind of understand some of its functions. Let's talk about symptoms. So I'm gonna show you a lot of research, human research, because I think it's important that we make this about people, not animals, as much. But some of the common symptoms: bleeding gums, anemia. This is especially iron anemias, or iron deficiency anemias. Muscle and tendon degeneration or pain. Varicose vein formation, or what are called skin petechiae, where you have broken blood vessels around the follicles in the skin. Slow healing. Recurring infections, as I mentioned before. Heavy metal toxicity. So these are some of the symptoms that we know people with vitamin C deficiency can develop, and it's not just those. I want to elaborate and expand on this. So let's pull up some additional research. I like the title of this paper, which is The Troubling Rise of Scurvy. And the reason I like that title is because what are we commonly told by our doctors? Scurvy doesn't exist. In the modern world, there's no such thing as scurvy. And the reality is, I see scurvy in my own practice a couple of times a week. And I don't have a high volume practice. It's not like I'm in the ER or in a clinic where I see 50 people a day. I might see 7 or 8 people a day in my practice. And I see scurvy a couple of times a week, as defined by low ascorbic acid levels in the bloodstream, but also as defined by clinical findings. So the troubling rise of scurvy, meaning that this disease does exist. And when your doctor gaslights you and says, oh, there's no such thing as scurvy in America, ask for more, ask better, especially if you find yourself in the pickle of having some of these symptoms. So here we go. In introduction, in the era of modern medicine, scurvy has been thought of as a rare disease of ancient times because of improved emphasis on diet and nutrition. However, isolated case reports are plentiful. If you want to go online and do some Google searching in the National Library of Medicine, you're going to find more than you can possibly read as far as case reports on vitamin C deficiency scurvies. And that's what these authors of this paper are talking about. And so in this particular study, they were looking at the rise of scurvy over time. And so they found that the incidence of scurvy increased over the study period from 8.2 people per 100,000 in 2016, meaning what this means is 8.2 people were diagnosed with scurvy out of every 100,000 people in the year of 2016, to an increased 26.7 per 100,000 in 2020. So that is in essence, it's a more than a 300% increase in diagnoses in a 4-year period of time. What they found was that patients with scurvy were more likely to be younger, male, and in the lowest income quartile. They were also obese. A majority, 64.2%, had a concomitant diagnosis of autism spectrum disorder. They also had common presenting musculoskeletal reports, including difficulty walking, knee pain, and lower limb deformity. Now, I want to highlight some things. One of the commonalities with people with autism, when we look at autism, is they have, we'll just say texture issues with food. And so they are, many autistic kids, young men, so to speak, are very, very meticulous about what they will eat. And so it's interesting that these researchers are finding that 64% of these scurvy cases are in autistic kids, because texture issue, a lot of these kids won't eat fruits and vegetables in adequate quantities, which is where we predominantly find vitamin C. So at any rate, I think it's alarming to see researchers finding a 300% increase in scurvy, although I don't think it's really an increase. I think what it is I think it's just maybe awareness. More doctors are waking up to the fact that nutrition is important, and I think we need to expand that much, much more. I think if we do, we're going to find that scurvy is actually a common disorder today, not an uncommon disorder. Let's look at this case study here. So 74-year-old Caucasian female presented with a history of acid reflux, irritable bowel syndrome, and presented with a 3-month history of persistent painful mouth ulcers or oral ulcers and recurrent episodes of joint pain, of what they called non-specific arthralgias, which is basically joint pain. She was referred to rheumatology and had an extensive workup, and that demonstrated that she had positive protein titers suggesting rheumatoid arthritis. They gave her steroids, a Medrol dose pack, which only led to modest improvement, although her oral lesions persisted. Additional autoimmune testing demonstrated that she was reactive to gluten. She had gluten antibodies, that's what this anti-gliadin here means, and that she also had positive anti-tissue transglutaminase. So basically, in this case, she was reactive to gluten, They found that her gastric anstrum, her small bowel, and colon demonstrated benign small bowel mucosa with normal architecture. So why is that important? Because this woman is reacting to gluten without villus atrophy. So normal architecture means she doesn't have damage to her small intestine that shows or that hallmarks celiac disease. And so a lot of times when doctors don't find this is kind of a hallmark key finding for them to be able to diagnose celiac disease. In this case, she didn't have it, but she did have antibody reactions to gluten. She also had positive HLA-DQ28 genotyping, which is a hallmark for gluten sensitivity as well. So enough evidence there, depending on the doctor, there's enough evidence there to help that woman to help that woman, make that woman understand she needs to be on a gluten-free diet. Her vitamin C levels were undetectable, and they diagnosed her ultimately with scurvy, which was the right diagnosis. 2 months after the initial vitamin deficiency was identified, her clinical response was noted with improvement in her oral ulcers. So giving her vitamin C, where the steroids wouldn't take care of the oral ulcers, the vitamin C correction of the vitamin C deficiency did. As well, she had resolution of her petechiae, which are little hemorrhage blood vessels in the skin, and modestly improved joint pain. She was able to eventually transition to oral high-dose vitamin C once more compliant with a gluten-free diet. So in her case, what was going on? She was eating gluten, and of course, with gluten, you get damage to the small intestine. So we got gluten damaging the small intestine. And in this case, where does vitamin C get absorbed? It's important to understand that part. Vitamin C gets absorbed in the area where gluten does some of its most damage, which is the distal small intestine. So what this does is gluten damages the small intestine. It reduces absorption of vitamin C. And so in this woman's case, and what these doctors reported, is that oral vitamin C wasn't enough. It wasn't correcting her vitamin C deficiency well enough because she was still eating gluten, and gluten was damaging the area of her small intestine that absorbs vitamin C. So what they did was they bypassed her gut by IVing her vitamin C to get her clinical response. But really, ultimately, for this woman, it was the gluten-free diet that most likely led to the reduction of inflammation in the intestines that allowed her to absorb oral vitamin C. You can see here at the end, the patient also had a notable psychiatric history with prior diagnosis of depression, anxiety, and recurrent panic attacks, which may have served as a risk factor for vitamin C deficiency. Why? Panic attacks, anxiety, psychiatric disease. Well, what does vitamin C produce? One of the things it makes or helps you make is dopamine. Deficiency in dopamine, and it also helps you make serotonin. Deficiency of these can cause anxiety and panic attacks. And so that could have been part of why, they were thinking vitamin C as well based on that history. And then you see here, it's likely that her celiac disease and RA were largely responsible for her early symptoms, whereas later symptoms to include easy bruising were due to scurvy. Scurvy can mimic rheumatological disease, meaning vitamin C deficiency can cause the same symptoms that present in patients that have rheumatoid arthritis and spondyloarthritis and other forms of autoimmune arthritis. And so scurvy can mimic rheumatological disease, especially when arthralgias, synovitis, which is synovial fluid inflammation, or manifestations imitating cutaneous vasculitis occur. Why is that important? Because if you have been referred to a rheumatologist, let's say you've got joint pain and you've got swelling in your legs and you've got easy bruising and little rashes that are appearing on your skin and you don't know why, and you get referred to the rheumatologist, and when you go to the rheumatologist, they're going to spend several $1,000s in money. They'll bill your insurance, but they're going to spend that money on this tremendous workup. But how many of you have ever been to a rheumatologist and had your vitamin C levels checked? I mean, checking vitamin C levels in the blood costs about $80. It's not very expensive. and it might be the solution. And it might not be a rheumatological disease. You might not actually have an autoimmune disease, because think about it like this. If you get misdiagnosed, instead of spending $80 on a vitamin C test to confirm or disprove or prove scurvy, what do they do when you get the diagnosis? The first thing the doctor's going to want to do is put you on biologics. If you have an autoimmune pain, arthritis disorder, biologics cost thousands of dollars a month, but they also contribute to cancer in the long run. And if you don't get biologics, you're going to get other medications like methotrexate. Methotrexate causes leaky gut and folate deficiency, and that basically it shuts down your ability to synthesize new DNA and RNA. So it reduces pain, and it reduces the progression of autoimmune arthritis, but the consequence of it is actually quite bad long term. And then your other option really is steroids. And as we'll talk about here in a little bit, steroids deplete vitamin C. So if you actually don't have an autoimmune arthritis, but you have a vitamin C scurvy mimicking an autoimmune arthritis, and they put you on steroids, you're just going to make your scurvy worse. Okay, let's look at another case study on this. And notice we always see this term in a lot of these. We see a rare presentation of scurvy in a well-nourished patient. You see that with every case report of scurvy. They'll talk about how rare, but there's so many case reports, and as I showed you earlier, we see that incremental rise in the ability of doctors to recognize how much scurvy is increasing. You see here the prevalence of vitamin C deficiency varies worldwide, with the United States reporting rates as low as 7%. Now, I point that out because 7% of the population has scurvy, according to reports in the U.S. 7% is not a small number. When you talk about celiac disease or gluten-related intestinal enteropathy, this is 1% of the population, and we have gluten-free food aisles and so much information out there about gluten. Many of you are just frustrated by it because you don't believe that anybody should have gluten sensitivity or be gluten intolerant. But 1% of the population has it for sure. But what we're saying here is that 7% have scurvy. But doctors will look for celiac disease. They will measure it, but very rarely will they ever look for scurvy when it's 700% more common than celiac disease. You see here, humans lack the capacity to synthesize ascorbic acid, but this organic substance is essential to the human diet due to its role as a cofactor in many metabolic processes, the most important being collagen synthesis. This is one of the hallmarks for the symptoms associated with vitamin C deficiency. Because collagen is the basis for your connective tissue, your blood vessels, which is tunica media and tunica adventitia of the blood vessels, and then osteoblasts, which are bone-building cells. So your protein in your bone is collagen, so bone remodeling is dependent on vitamin C. So in individuals who eliminate foods high in ascorbic acid from their diet or suffer from malabsorptive GI conditions like celiac disease, vitamin C deficiency can present with classical scurvy symptoms. Without dietary ascorbic acid, collagen fibrils are not properly formed, leading to symptoms of deficiency. We'll talk about those here. Actually, let's just go ahead and highlight a few of them. Classic symptoms include mucocutaneous petechiae. This is like hemorrhaged tissue, poor wound healing, slow healing, ecchymosis, which is like pulling of the blood under the skin, hyperkeratosis. So if you ever take your arms and run them across the back of, or your hands and rub them across the back of your upper arms, if that skin is nice and smooth, you're in good luck. But what I see a lot clinically, especially in kids, is there's big bumps on the back of the arms right here. And then if you look at it, they're super red and they look a little bit inflamed. That's called hyperfollicular keratosis. And so that's this symptom here, hyperkeratosis or hyperkeratotic papules or hyperfollicular keratosis. Those are all just different ways to say it. Corkscrew hair, so little coiled hairs. Gingival swelling, so the gums swell and start bleeding. So if your gums are bleeding when you're brushing your teeth, that's like a hallmark that vitamin C may be a problem, deficiency may be a problem for you. And then rheumatologic problems include muscle and soft tissue hemorrhaging and painful arthrosis or arthritis. You see here, recent reports of patients with unresolved symptoms were found to have GI comorbidities such as inflammatory bowel disease and celiac disease, suggesting a malabsorptive etiology for scurvy. And this is what I was just showing you, the case study of the woman with celiac disease, ultimately was diagnosed. If you've got inflammatory bowel disease and you're not monitoring your vitamin C, you should be. Because if you have a disease that damages the bowel itself, you're gonna reduce your capacity to absorb the vitamin C, and then from that reduced capacity suffer the potential consequences. Here's what hyperfollicular keratosis looks like. If you can blow it up on this picture here, but you can see these red spots they're elevated on the skin, and if you look in there even closer, you can see little coiled hairs. Those are what are called corkscrew hairs. And then here's kind of a blown out version, and you can see down on the leg ecchymosis where that blood is pooling. So, you know, you see this area right here is just blown up right here. But that's what it can look like on the skin, and it doesn't always look this severe. Sometimes it starts out milder and it progresses and it gets worse. You see here in this case, vitamin C deficiency masquerading as vasculitis in a patient with Crohn's disease. Patient's diet was nearly exclusively made up of highly processed fast food with no fresh fruit or vegetables. We think about there's a current diet that's become very popular, which is the carnivore diet. And I know some people swear by the carnivore diet because they feel better on it. And this is not me saying those people are wrong. Their experience is absolutely right in their situation. I think one of the longer-term risks of a carnivore diet done wrong is scurvy, and I've seen cases of that in actual patients being on a carnivore diet for extended periods of time, because there are no fruits and vegetables on a strict carnivore diet, and so it's such a popular diet right now. I would just say those of you following carnivore, get your vitamin C levels checked. Now, if you're eating liver, you're going to get some vitamin C from liver, but if you're just strictly eating meats, and you're not eating really anything else. I mean, there's a little vitamin C in eggs, there's a little vitamin C in liver, but outside of that, there's really not much vitamin C in animal food. So just be aware of it and get it checked. You see here, rash on the lower legs, mild gingival hemorrhage, and enlargement and muscle soreness were among this man's symptoms. Anemia and undetectable vitamin C levels were discovered in laboratory studies. The skin sample itself revealed follicular hyperkeratosis, which is what I was just talking about. Misdiagnosis, so if they had not looked for vitamin C deficiency in this particular situation, this is their thought. Misdiagnosis might result in unneeded treatments and medical expenses. Scurvy must be diagnosed as soon as possible because it might cause gastrointestinal or intracerebral hemorrhage and death. Scurvy can kill. I think it's important that you understand that. If it's left undiagnosed and it progresses, you can die from it. Okay, here's another one. Or musculocutaneous manifestations of scurvy. This was a man in his 20s, 6-month history of worsening left leg pain, weakness, swelling, and stiffness, which limited his mobility. He had generalized anxiety disorder. There's that anxiety again. Vitamin C, it's very, very common for reduction in vitamin C to cause anxiety. And this gentleman also had food allergies. The examination demonstrated left leg edema, so that with vitamin C deficiency, your lower legs can swell and retain more water with ecchymosis. And so you can see that here, that's in this diagram right here, that's that pulling of blood underneath the skin of the thigh and ankle, and diffuse lower extremity petechial rash. So all this right here is that petechial rash. It's that rash that breaks out on the skin, and the reason that rash happens is because the tiny blood vessels in the skin are made out of collagen, and without vitamin C, that collagen is easy to break and rupture, and so it leads to this damage in the skin. Okay, let's look at another case study. This one you can see scurvy mimicking spondyloarthritis in a young man. Well, spondyloarthritis is what I was talking about earlier. This is an autoimmune arthritis, and the general treatment is methotrexate and or biologics, steroids, pain medications, or what are called disease-modifying anti-rheumatic drugs. all with tremendous consequence, right? So in this case, it was scurvy. It wasn't actually an autoimmune condition, but it was actually scurvy. 20-year-old male admitted to the department because of walking inability and back pain. You say vitamin C deficiency causes back pain? Absolutely, it causes back pain. And sometimes it doesn't lead to the severity. Sometimes it's so that, like, there are levels of deficiency, and so the lower and the longer and the lower your levels are, the more you get collagen disruption and damage that can manifest as musculoskeletal pain, i.e. in this case back pain. And this gentleman here, MRI showed bone marrow edema. This is another finding of vitamin C deficiencies, is edema in the bone marrow of the sacroiliac joints in multiple slices and edema of both femoral heads. On MRI, if you've got, periosteal edema or periosteal edema, that might be scurvy. That might be vitamin C deficiency. Some inflammatory characteristics of the back pain and radiologic findings were suggestive of axial spondyloarthritis, which is this disease here. Physical examination showed petechial rash and bruising in both arms and marked underweightness. His past medical history disclosed scurvy as well. Vitamin C supplementation completely resolved every clinical manifestation while he was hospitalized. We found low vitamin C levels, 0.2 milligrams basically per 100 milliliters. Really anything with vitamin C, anything less than 0.4 milligrams per deciliter in the blood is considered low. And if you get below 0.2, it's really, that's when they start considering scurvy. They also, in this gentleman, found high C-reactive protein, which is a protein released when there's inflammation. So we prescribed only adequate vitamin C supplementation and a balanced diet. After 1 month, low back pain completely resolved and the patient was able to walk. The ecchymosis and bruising disappeared. After 7 months, MRI of the sacroiliac joints and the femoral heads was normal with complete resolution of edema. So in this case, this guy could have gone on to a rheumatologist and been pumped full of toxic medications for many, many years. But he had a smart group of doctors that recognized that his problem wasn't autoimmune disease, his problem was vitamin C deficiency.